because for some, your clients will lose their denture. It might go into the linen, into the washing. What's the time? What would be the time frame that they would have to?
Professor Booth would probably be able to answer that one. The time frame for making of a denture in private practice, Professor.
It's really dependent on laboratory time more than anything else. We should be able to get one made in about 4 weeks. They usually like about 10 days work time, but the average would be about 4 to 6 weeks anyway from start to finish, depending on your clinical time as well.
Is it even for the replacement?
For replacement, well, it depends. If the replacement's because you've lost them, then that's the length of time it takes. If the replacement's because you can often use the old dentures as a base and work with those, and those can be turned around in probably just a week or 10 days. If you've got the basic design, position of the teeth, the bite, the way they meet together, if that's all right, it's just the bases that are wrong, then you get a new set made, get the other ones duplicated with a new base on them in a very short time. It just takes an impression a little bit of time.
Sorry, I had one question about the screwed-in teeth.
Yeah.
Yeah.
The implants?
The implants. Is it more safe than the false teeth? Is it better to get those? Is it more safe?
There is a little bit more favour in going into these teeth because in terms of biting, they replicate the natural teeth a little bit better in terms of like the biting force. But the thing is though, it's got to do with eligibility because sometimes that bone needs to be at a certain level to be able to support those implanted teeth. Because if the bone isn't strong enough to support it, it's going to fail. So that's when dentures, I feel, are a more appropriate alternative when the bone levels are not as ideal as we'd like them to be.
Now we expand that a little bit further in that it may be necessary to augment the bone, so you can do that with bone grafting, so that you can have a good quality and a good depth of bone to put an implant in. But if you're talking about stability for a denture and the ability to eat comfortably for a denture not to move around, then the implant is a very reasonable clinical way of being able to deal with that. They're locked in the bone, the denture fits over the top of it. They like to call them bridges these days, or removable bridges rather than dentures. But you can either have them that clip over the implant that's there depending on the fixture, or you can actually screw them on there so they don't come out. It's better that you can take them out because of cleaning underneath them and keeping the soft tissues healthy, but you can have them either way. But they're very successful. So for the patient who has little or no bone left, because that happens with elderly patients, and they can then have implants put in if you have to augment the bone there, it changes the whole way of life. It really does, because there's no longer any soreness, the dentures don't move around, the chewing forces are really very good on there, so there are lots of positives. The disadvantage there obviously is that they're expensive. It's the cost factor that goes in there to do that, so it's a lot more expensive than just having a conventional denture made.
And I guess the associated surgery as well, which is usually more invasive. You have to go a bit further into the bone.
I just have a general question. What's the best toothpaste and fluoride with it as well? What do you recommend for anyone?
So most toothpastes that you have, so we have up here, we have Sensodyne toothpaste. So when people have sensitive teeth, you can use this. What this kind of does, in layman's terms, it kind of coats the tooth and stops sensitivity. But for general toothpaste, we recommend 1,000 to 1,500 parts per million of fluoride content. So a lot of toothpaste, Colgate, a lot of Oral-B, a lot of your brands, they follow this. I don't have a specific recommendation for what's in the toothpaste as long as it has fluoride, because fluoride is there to help remineralize your teeth and to help resist bacteria.
So there are like fluoride-free toothpaste around there for like free natural. Is that okay? Like if it's a personal choice, people say I don't want to
I mean, ultimately, it will work as a toothpaste, and you can brush your teeth with it. If you do thorough brushing, there will be some efficiency in plaque removal. However, the only issue is that fluoride actually helps remineralize the teeth as well, so it actually adds additional action to your cleaning. So you're not only doing that physical, mechanical removal of plaque, but you're also reinforcing your teeth with a little bit more, fluoridated minerals. So you can use the other one, but it's ultimately more efficient to use one of your standard toothpaste, which is going to have that
So
fluoride
if
concentration.
ever they choose to use the fluoride-free toothpaste, would it be okay to, would it be better to suggest to them that they, instead of brushing their teeth twice, it would be 3 to 4 times a day?
You'd probably need to be more vigilant, I would say, simply because, once again, you wouldn't have that ability of reinforcing your teeth with that fluoride. So I think it would just come down once more to just proper vigilance, really.
I want to add one point. Toothpaste is great, but what the real cause is the carbohydrates, the sugars that we eat, the snacking in between meals, because that's what's going to do the most damage. So bacteria that are in our mouth, they eat the sugar that we eat, and then they produce byproducts, and those byproducts kind of eat away at the tooth. So that's important. So to reduce sugar intake, to try to do 3 meals a day, and try not snacking in between those meals. So,
Drink a lot of water.
pardon?
Drink a lot of water.
Yeah, and drink a lot of water.
Very true.
So that's a very important thing. It's not just toothbrushing. It's what we eat and it's what we consume.
Well, yeah, and that's why saliva comes in, because it's important. Because if you drink a lot of water, you have a lot of saliva, and the saliva has like this flushing action on the surface of the tooth. So it's kind of like a hose jet that it just essentially gets a lot of the, those bugs off the surface of the teeth. So we're not impacted by that. And fluoride is good in the sense that it just makes the teeth surface a lot more resistant to the acids produced by bacteria, so it's not eaten away as readily. That's why we always recommend fluoride toothpaste.
Sorry, Patty had a question? What if people, the clients, they have an allergy? Some people, they do have an allergy. What do we do? Give that person to brush with, like if they're allergic to the toothpaste? Some people have an allergy to the toothpaste.
You could use bicarb soda, or we could just look into other products, because there are other products on the market that we could look into that would suit those needs.
My kids brush their teeth with salt water if they run out of toothpaste. Maybe that could be.
I think we're putting an awful lot of emphasis on toothpaste. What we're really needing to do is we're needing to physically remove the deposits that are on the teeth, whether it be food or whether it's the bacteria that are there, the plaque. You'll hear these days it's called the biome. It's a very complex system that's there. You need to physically remove that. The toothpaste helps with that because it's obviously got things like soaps in it to be able to clear some of that off. But the main thing is you can clean your teeth well without using toothpaste if you really want to, so it would overcome that. It's physically removing the debris that's there that is the most important thing. What toothpaste does, it makes it more pleasant to clean your teeth, because and we all know, and we all come away with our minty breath thinking we've got clean teeth. It's not necessarily the case. So the mint is there to hide the taste of the other things. It is a vehicle for carrying certain things there, so we're using it as a vehicle to carry toothpaste on your teeth, to strengthen that way. So that's where the fluoride toothpaste has its benefit. One of the things that I would also say is that although Cairns no longer has fluoride in its water supply, to our regret, and to everybody, should be everybody else's regret, a lot of the processed food that we get, a lot of the processed drinks we get come from the south. So they come from Sydney, they come from Melbourne, they all use fluoridated water. So you actually can't take fluoride out of your diet unless you have completely pure foods, pure water. It's not possible to do that because of the manufacturers. So we're getting the benefits of fluoride, I suppose, second hand, if you like, rather than just on toothpaste alone. Toothpaste is a way of doing that. bearing in mind that toothpaste, the fluoride helps as far as decay is concerned, and that is a problem with the elderly because they're more susceptible to decay because of diet, the inability to clean their teeth properly or have their teeth cleaned properly, the roots of the teeth being exposed, being more open to decay on there. What we're really trying to do is we're trying to protect the gums more particularly as you get older, because you'll lose your teeth probably more rapidly through gum disease than through caries and through decay in the later years. So you need to clean the teeth off physically, and that's why the toothbrushes are there, and why we recommend you to keep those, to keep their patients' mouths clean. It is a fact that once a patient goes into a nursing home or into care like that, within 2 years, their oral health has deteriorated markedly in that time because of lack of care and lack of control. So I think one of the messages that comes out of this, or should come out of this, is that it is a very important part of maintaining their health and giving them a quality of life so that they can eat, they can function better, and again, people who maintain their teeth for longer periods of time live longer with a better quality of life. So that's how the whole thing links together. So it's not just us saying, well, you've got to clean your teeth and you've got to clean their teeth. The reason behind that is about giving the patient a better quality of life. They'll be able to chew food. They won't have to have food that is over-processed. So there are major benefits about that. Reduce the amount of toothache they get, loss of lack of teeth, lack of gum disease. So it is important for you as healthcare workers, I think, to get in there and make a difference, because you can. The dentist can't, because the dentist may only see the patient once a year, certainly in care homes. You see them every day, and you're the ones to make the difference.
Thank you.
Would you recommend the public to use dental floss?
Sorry, I didn't hear.
Would you recommend to use the dental floss daily basis?
Yes, yes, absolutely. Because
How often?
usually just once. Like I prefer before going to bed, just because even when we brush our teeth, it's very hard to get rid of things in between our teeth. So what the floss is really good at is actually removing things in between our teeth, so we don't actually start getting decay happening on the sides of the teeth. Because those are the ones where they're not super obvious, but by at least flossing on a regular basis, you sort of clean out the gum pockets, so there are no things that are trapped there and that are left to fester.
So, sorry, can I answer it further? When you use a dental floss, no time? Okay.
No,
Last
it's
question probably.
Yeah.
I'm just conscious of Jane's next.
Yeah.
Okay, just to give a little bit more like information about dental floss. When you use dental floss, most of my patients actually they use just up and down motion, but it doesn't really work that way. Tooths look like this, and they have a curvature here and this side and this side. The purpose is we scrape all the way down to the gum, below the gum, and then we remove it, okay? So when you use a floss, not up and down motion, follow the curvature over the one side of tooth and then remove it, and then the other side follow the curvature of the tooth and then remove it. So you have to go both sides, okay? And sorry.
I just want to know if mouthwash is suitable for all ages, but should the elderly be encouraged to use mouthwash as well? Like, is it?
I think
Is it
there's very
necessary?
little clinical evidence to suggest that mouthwashes do any good. It's an expensive way of just spitting things down the drain, as far as I'm concerned, because what it will do will only affect the superficial layers of this biome. It won't actually get to the underlying layers, and therefore the effect is very limited. I know that they're pushing it, but in my book, it doesn't actually replace good physical removal of that sticky deposit that builds up on your teeth. Getting back to the floss very quickly, is that you will find with the group of people you're dealing with, it will be impossible for them to use floss because they've lost the ability to do that. Even with the flossettes and various other things like it, it's very difficult to do. It is probably more important that they develop using the interproximal brushes, the Pigsters or the TPs or whatever they might be, and there are some down there to clean in between the teeth, because that's an area that is missed when you use your toothbrush, and that's the area where most gum disease starts, and where the necks of the teeth become more susceptible to decay in older patients. It's a very good way of actually getting things like fluoride onto those surfaces. Well, there are a whole series of ways, but floss beyond the front teeth is probably very limited in its action. It's more appropriate for decay under the contact points than it is when you get down to gum level, improving gum disease. Okay?
Okay.
Thank you.
Guys, thank you so much. We've
Thank
just
you.
had over an hour of fabulous education